Welcome to Season 3, Episode 3 of the Georgian Surrogacy Podcast. I'm Liz Tripodi, back with you, still in Tbilisi, and my very special guest, who I know that so many listeners around the world have messaged me, have sent me questions, have asked where it is. This is 6 months in the making. I finally have Dr. Keti from Chachava Clinic with me today, live in the flesh. Hello, Dr. Keti.
Hello, dear Liz.
So, you are probably the busiest person I know and the most glamorous person I know. Now, we have known each other for a long time personally because, of course, without you, I wouldn't have my twins. And I will always be forever grateful. See, I am already starting to cry. I will always be forever grateful. I remember meeting you that, 6.5 years ago, I think it was now. Walked into your office and you were so calm and just this beautiful smile on your face. And do you remember I was crying, sobbing, and you said, it's okay, everything will work out and it will be okay. And it was. So thanks for joining me.
Oh, you're so wonderful. And you're always talking about me so high. I'm getting red.
Well, you are world famous. And, I now call you the magician. So you could start your own magic show because truly what you have done, not just for me, but I know for thousands of people around the world, you have created families. And I know that is your life mission, is just to help people create families. And thank you from behalf of me, for everyone that has gone before me, and for everybody that you continue to make their dreams come true.
I'm not the magician, Liz. I'm not the magician. I am just the person who loves her job.
Yeah.
So I love my job most of all. This is my passion. This is the love of my life.
Absolutely.
And
so tell me,
this is what makes me happy. So
how did you get into this?
How did I get into this? I got into this in 2013. And this started together with my first child.
Yep.
And this is really like my child. This center is really my fourth child.
Yep.
Now I'm the mom of 3 kids. And this center is really like my fourth child. So I've invested so much here. All my emotions, all my time that I've taken from my own family.
Yep.
But I feel obliged. And I feel that this is my duty.
Yep. Your life's mission.
Yeah, my life's mission. And I think I've discovered what I would have done with most joy and with most love in my life.
Yeah.
So what I would be doing. So this is what I found and explored.
Yeah. And if you're hearing little beeps in the background, everybody, I can't edit them out because, of course, while we're sitting here, Keti's phone is going a million miles an hour, as it always does. Put it on silent. So tell me, this is the Reproductive Health Centre of Chachava Clinic. Right. So tell me what happens here.
Okay, so this center from the very beginning was created for international patients who have gone through very difficult time, through very difficult infertility journey. And we're looking for the final point where they would get what they have been struggling for their whole for decades, let's say, okay? And from the very beginning, this center was created for the medical tourism, and we did never make actually aggressive marketing. Well, to what we've come to is the patients, word of mouth. And all this accumulation of patients is because of We've been doing this, and my whole team has been doing this with great love and with dedication.
Yeah.
And I've seen so many desperate people from all over the world with different stories, with different
Everyone's
ways.
different.
Yes,
Yeah.
everyone's different. People who have been born with already with the condition that and understanding that they would never get moms, become moms.
Yeah.
Sorry. And the people that have gone through very tough time and understand that it's almost impossible for them to become parents. But here it is possible for them to reach the goal and to feel what is real parenthood. So there are so many. I could even not imagine that so many women may be born without uterus. There are so many patients born, ladies born without uterus, having their own ovaries, but not having their wombs with what they could carry their own genetic children. So this is a miracle for them. This is a miracle to have their own children born with that like of condition.
And I think it's important to note as well that Reproductive Health Centre doesn't just do surrogacy. Of course, there's donation, there's IVF treatments, there's other fertility treatments that go on here. So how many patients do you think you see a year?
Oh, thousands of patients.
How do you fit everybody in? I mean, it's just incredible.
A lot of time investments, and a lot of energy.
I know you don't sleep. That I know that's, Tell me, what's the toughest part of your job?
So, as you say, if I was a magician, I would not deal with that tough part. Okay, so that's the most tough part of what we do. We cannot do everything.
Of course.
We are not able to do everything what we want because we don't have control on everything. And there are the conditions and cases that we cannot
you can't
bring
fix them
to the successful end. So unfortunately, this is the toughest part because I totally feel what the patients are feeling.
Of course.
And this, even sharing with them the news, that's negative news, is so difficult.
I know, we take it so personally. I understand.
Exactly.
You become so invested in everybody's journey and what they've gone through as people.
Yes, it's not just the case. This is life. Every day I'm dealing with, and we all here are dealing with lives. Very personal things here. And it's like survival issues, like existence issue. So I know you're getting goosebumps because you're just so passionate about, and you're very much a feeling person. I know that you take every patient that walks through these doors. You care so deeply for each and every one of them. I believe that without these emotions, I would not do what I'm doing now. So I believe would not be as successful. So I was trying to shut down these emotions, but
you
just
can't.
impossible.
When it's part of you as a person, you can't. It's who you are.
And the quality of the work would not also be that high if I turn out that emotions.
Absolutely. So what should people be aware of during the IVF process, and explain different problems that people might have or the options that are available?
I could not get that.
That's all right. So, for people that may not have ever gone through IVF, what happens during IVF?
People think it's difficult procedure,
Yep.
but overall it's not. It's not a long process.
Yep.
It's only half a month.
Yep.
Just you need the thorough examination before we start the process, and it's. Should I explain the?
You can if you like. Absolutely. Yeah.
Yeah. So when the couple is starting IVF process, the first step is to have the examinations of both lady and the partner should be examined thoroughly, and after the IVF. Plan is made. So we have a possibility to start the IVF process in their countries and arrive later here.
Yep.
That's possible. In that case, from our side, it needs more involvement and investments because it's not so easy to coordinate with another doctors, with their measurements, with their opinions as well. So it's a bit difficult for us, but still it's going perfectly well. We are creating the groups together with the coordinator and the patients for WhatsApp, and I am coordinating every detail on the way. So I'm giving the plan for the IVF treatment. I'm giving the exact dates, when should be these done, when should the ultrasound be done, when should the medications be started, based on the examination results, based on the test results, which I get from them. And patients may start injections at home, like inject for 7 days, 8 days, and arrive later on the 8th or 9th day of injections. This makes their stay shorter. And we will be needing another 7 or 8 days here in Georgia. I continue. So as far as the last part is most important, in terms of the monitoring and measurements to be as accurate as needed. So this is why I asked them to come here before trigger shot on the 8th day. So I continue the monitoring, I continue measurements through the ultrasound, and then we plan the oocyte retrieval day. And the oocyte retrieval is performed under deep sedation. So the patients are not conscious. It's just 15 or 30 minutes long. It would depend on how many eggs are expected. And it's absolutely painless procedure. And on that day, partner is also providing sample. It's easier part for them.
Yeah, of course.
And we're making the fertilization on the same day. Usually we're doing all ICSI. It's our standard for all our patients, but sometimes some patients are asking for the IVF, and we may also do, if we have lots of eggs, like part IVF can be done, and on the part of the portion could be done ICSI. And then the patient is free to go back. So we take care of the embryo culture. And we culture them to day 5 usually. This is also our standard. And we freeze the embryos and give the updates to the patients.
What problems can happen during the IVF process? Is there anything like, they might not be ready for retrieval? Like, what happens in those sort of cases?
Actually, it's better to come prepared. There are some cases when they just decide, okay, I'm going now, I want to start now, but that's not correct way. So, there should be plan made in advance. Some examinations should be made in advance, because if there are some problems in the examination results, it would impact the outcome.
Sure.
So I would definitely prefer to see meet the patient in advance and make the plans for her and make them examination list for her. And then after I see the results and I review everything, then after plan the arrival.
Yep.
Okay.
And then, of course, donor eggs are done exactly the same way, aren't they?
Definitely.
Yeah.
Yes. The donors are done exactly the same way. Just the parents do not are not involved in that much detail.
Of course.
Yeah. And for the donation cycles, we don't need the parents to come here for a long time.
Yep.
It's just for a couple of days, for 2 or 3 days, and it could be done either on the retrieval day or could be in advance to freeze the semen. But it depends also from the semen quality, and this is also this kind of information is also provided to the couple in advance.
Yeah. I've got a few questions that I want to ask you, and I obviously don't know the answers to these because I'm not a medical professional. So women, this is a question that I see quite often. Women with very low AMH, what are the ways that they can have their children using their own eggs?
Yeah, unfortunately, there are not very much to do. Still, regardless of so many researches ongoing, so many advances, still the aging process is not
kind.
not kind and not able. We are not able to stop this aging.
Yeah.
So the low AMH is related to the aging process.
Yeah, sure.
Yeah. Or there could be also the conditions when in the early age, AMH is still low, and this is also the deficiency of the ovarian reserve. Low ovarian reserve could be also present in the earlier ages. That condition is better. I mean, if the lady with the low ovarian reserve at the age of 30 up to 35 has better chances compared to the woman who is aged above like 40 but has the same AMH.
Okay.
Because there is the quality issue. So age is the very crucial factor for the outcome. So we say that, let me repeat again, for instance, the AMH 0.5 with the patient who is like 32 or 35.
Yep.
And the same AMH 0.5 for the 42 or 41-year-old lady. So the outcome and success rate is absolutely different.
Okay.
The younger one has much better chances than the older one. Yes.
Okay. Another question. Would you implant a 4cc day 5 embryo if the IP has only one other embryo left?
Yeah. If the embryo is alive, we will, and there is no other option, we would implant because that still has a chance. Lower chance, definitely, but still has a chance.
Okay. You still do, and I know this because I've seen this for myself, but I'll still ask the question. You still do transfers and oversee cycles yourself? Yeah.
Yes, I do. Still do. I cannot stop.
I saw you in action the other day, and I was absolutely, number one, I was honoured that you asked me to sit in on an egg retrieval. It was the first time that I have done that, apart from obviously being a patient myself. So thank you for that opportunity, and to see you in action and to see the care that you gave the lovely patient and the wonderful result as well was just a really beautiful process to see you and the team working. And it wasn't a sterile environment. It was a very happy, relaxed environment, which I think for the patient is so important. And I must say that I know that everybody that I know that's come and actually done IVF here themselves, they have praised the team here and the nurses and everybody for making them feel so comfortable. I had one of them tell me the other day that one of the nurses was singing to her. Well,
lullaby, yeah.
I think so. I think so.
Before getting to sleep. Yeah, I think emotional support is very important because people are coming from so far away and they don't feel home. Is in absolutely another country, hearing another language. And definitely the level of their stress is higher.
Yeah.
So we need to make it slower. So we need to support them. We need to make them feel in a friendly and warm environment.
Absolutely. Can intended parents choose their doctor here, or how does that process work?
Yeah, they can choose the doctor here.
Yep.
Or usually the coordinators match.
Yep, match one of the doctors. Yep. You were talking about emotional feelings before. How would you advise parents going through the surrogacy process in particular, how to manage their mental health when they've got limited information on the well-being of their child that they might be expecting?
It's easy to say, but still, I think they have to take it easy during the process, okay? As more they are like digging and looking for something and looking and having negative expectations, it's worse. So
I think having social media actually is worse because Google, I remember, every time you'd get a result or you'd get a doctor's report or you'd see a number, you'd get straight onto Google and you'd see what it is. And it starts to send you crazy.
Yes, it does. And when for example, for instance, there is the need of intervention and there is like 0.1% risk of infection, for instance, okay? And some parents send 10 emails about what if the infection
I know.
okay, so exactly that 0.1%.
Yeah.
Okay, what if this happens? What if this happens? What in this case? What in that case? So, and that's absolutely not usual to have such outcome. Yeah, but especially to that patient, that's very unusual outcome.
I know.
Happens. So it's I think the law of attraction works a lot also in this field.
Absolutely.
Yes, as in our lives overall. So this law of attraction, you're sending something, the thoughts and emotions to the galaxy, and the same is like coming back to you. So I'm just asking to all patients just to rely on us, try to be as calm and peaceful as possible. Try to find peace of mind.
Yeah.
And rely on us. That means that just be sure that we will be doing our best, the best as possible to maintain everything in a perfect way.
Yeah.
Not always it is possible. This is the body. This is not the machine. Yes. This is not robotics. And still there are some unforeseen circumstances happening. But yes, they need to have their expectations on a realistic level.
Yeah.
But not concentrate on the negative things. Okay. So
I think you've just made you used a really important word there, and the word that you used was machine. And the reason why I think that is so important is I think sometimes during this process of us wanting to become parents, I think especially when you live so far away, or you may not have visited Georgia before and you may not have been to Chachava before, this is not a factory. This is not a machine. And I think this is my personal feelings, is that we don't have a machine that creates surrogates that are ready tomorrow and are ready the next day and the next day. Exactly. And that was leading to my next question and I'll lead into it by saying and I love that you use that word machine, because I think people forget that this is not a factory. This is a maternity hospital. This is a reproductive health centre, and we are dealing with human life. We are dealing with real people on a day-to-day basis. We can't just pluck surrogates out of, to start with, Chachava, led by you, of course, as clinical director. We are so fussy about who is accepted onto the surrogacy program, and we don't just take anyone who walks through the door saying that they want to become a surrogate. It is not a factory. It is about the right emotional, psychological, medical fit. So, and I know that we get more people asking to be surrogates that are accepted on our program. So I want to ask you, when and why do we turn surrogates down? And how do you ensure that they're healthy and a good fit to join this team? Because that's what this is. It's a team effort to find the right surrogate for the right situation.
Exactly. This is not a factory. We are every day dealing with individual lives, individual characters, individual emotions, individual stories. So recruiting the surrogate mother is really very difficult process, very tough process. This is the big responsibility from their side, and we need to understand that they realize this responsibility, what they are taking on them. So not only the medical part could be the deciding factor to turn the surrogate down, but also the other things could be deciding. We are very critical. We have very strict criteria in terms of the medical part, because the recruiters that are bringing in the surrogate mothers always telling us that you are always rejecting, but they are going to other places and they are getting even pregnant, and successfully pregnant could be, but we have rejected these people. And we're not saying it's not possible. We're saying risky, okay? And we don't want to take that risk.
Especially when you might only have one embryo left, or things like that.
Exactly. So we don't want to take that risk. The risk itself is the possibility, yes, and it's not 100% that this will be not right or not or work well. So we are weighing risks and benefits much. Okay, and we have really strict criteria when recruiting the surrogate mothers, and the big part is their personalities, their understanding what they are doing, how they understand the process,
their psychological well-being,
how they follow the medical indications, the prescriptions, how they understand this is very important. And we work with these girls very close. We have coordinators especially for this. They control the process, and they communicate very closely.
They're very well. I've seen all the surrogate coordinators here, and oh my goodness, the relationships between them and the surrogates is fantastic.
They're becoming friends.
They're like their mothers. It's beautiful.
Yes, and friends.
Yes,
and they are protecting their interests also during the process of surrogacy. And I ask them a lot. What do you think about this or that? So on the stage of the recruitment, they get an impression, and they get very accurate impression about these girls. But still, this is the very individual thing,
Yep.
very individual thing, and it cannot be 100% perfect,
course.
everything. So the expectations about this is not the self-pregnancy. I'm also telling the patient this is not her own self-pregnancy that you may take care of. This is still surrogacy. They are carrying somebody else child, yes. So this still differs.
Yep.
And you don't have to expect that everything should go very smoothly, very perfectly. There may be some deviations, okay? So ups and downs during the process. And these ups and downs may be very different, various.
I know that you're not a fan of data, and I'm not a fan of data either. But what's the usual success rate per attempt? And I guess for anyone listening, and we're now heard, can you believe it? We're now heard in 71 different countries. Isn't that crazy? Success rates with donor eggs as opposed to success rates with own. What do you?
There's quite a difference.
Yeah.
With the donor egg, success rate is maximum.
Yep.
Per attempt, like 80-85%.
Yep. Okay.
But with own eggs, it again differs according to the different age group.
Sure.
From who these embryos are coming.
What about if it was donor eggs and your own sperm? What sort of success rates do you see with that?
Man aging is still
man aging still a problem. Okay,
still a problem, but still less problem than
a woman
aging. So
and I think what
women age earlier. Than
one thing I think that is not spoken about enough is, of course, you see so many men here too that also have problems. It's not just women.
Exactly.
Yeah,
yes.
And I think that's something that we need to tell families and the couples out there that there is absolutely no shame if it's a male issue or a female issue. You know, there are procedures that can be done. I mean, I know that you do them daily. So just run me through a little bit about what you can do for a man. I know you recommend there's certain vitamins leading up to samples and things like that.
Yes. And some men also are needing to perform the testicular extraction of the sperm. So this is kind of intervention like with the woman.
Yeah. Does that hurt?
No. Okay. That's also almost the same way.
Okay.
Yes, the extraction from the testicles.
Okay.
Like aspiration.
Mm-hmm.
The vitamins, and there are also some hormones may be recommended.
Okay.
The stories differ.
Yep.
And there are so many different pathologies that could cause the problems in the men.
Okay.
Yes. So the pictures and the histories may be different.
I've only got a couple of questions left to ask you because I know, I so appreciate your time. And this is a difficult one. What makes you different or better than some of the other clinics out there? What do you think?
I don't know. I never compare myself or my stuff to others.
Yep.
I know what I am doing.
Yep.
I'm never comparing. But I can say what I think makes us good.
Yep.
We are doing this I'm also doing business, yeah?
Yeah.
And they say this is the business.
Yeah.
But we're not doing business for business.
Yes, I get it.
So I think, I am in the first place doctor with the soul.
Yeah.
And then after the business woman.
I attest to that. Because I never felt like I was a number when I walked through this clinic. I felt like I was treated so beautifully.
My team is also have the same attitude.
Yeah. You've got a wonderful team.
Towards
I know everyone has
patients.
been with you for many, many, many years, starting with Nana, the head embryologist, who
She's
is
so much
amazing.
dedicated.
Oh, Nana is so
much-
dedicated.
So much dedicated to single cell.
Yeah.
Yeah.
And the doctors that have been with you.
Single
And,
embryo, single cell. She cares about them so
Yeah.
much. And also that on the first place is not the numbers for them.
yeah,
Yeah.
that's really good. What do you think is the future of IVF and surrogacy in Georgia? Because there was talk, 2.5 years ago of the government, changing the laws. We know that that's now off the table. But what can you see for the future? Or what would you like to see?
I don't even want to remember about that time. It was so tough because we had so many patients on the list, and then this ban was announced. But personally, I fight it a lot.
Yeah.
And it was a big role of ours, the Reproductive Society. To stop this process.
Yeah.
So in the end, we stopped this process, and we assured and convinced the decision makers to not go ahead with this because this was absolutely stupid thing. I can't see anything more beautiful than this. What can you find the better kindness, better...
I know you're creating families.
Yes, than creating the families and surviving somebody's lives. So
I think as well, Georgia, from an international perspective, Georgia has actually become known, apart from being a beautiful country. But it's funny now, like when I started the journey, you'd talk about Georgia and you might talk about the wine, like what's Georgia known for? The wine, the countryside, things like that. It's funny because now in the media, when you hear Georgia, especially in our sort of countries, it's known for creating family.
Yeah, wonderful. I'm again getting good.
So did I. I just did as well. And you know what, Dr. Keti, for anybody that has had the pleasure to meet you or that will meet you in the future, you said it yourself, they are just in great hands. Again, I thank you from the bottom of my heart for everything that you do and everything that you have done and everything that you continue to do. And you lead every day with a smile and by example. And I don't think I've ever seen you have a bad day. And just to finish off light, what's your favourite things in the world? I know your children.
Yeah, my children.
Yeah.
My job.
Yep.
Yeah, I think I'm a lucky person because I know people who don't find what they have been born for.
Yeah.
And I think I'm born for my family and what I am doing.
Absolutely.
So,
and I couldn't think of...
I never have the questions to myself. Why? What have I done today? How my day passed or how my life is passing. I think I can be very happy in the end before the end of my life.
I think you can too.
I've gone through a very fruitful life. And this is most important reason to live. Yeah.
Absolutely.
So I think I found the reason.
I think you did too. I think you're doing okay. Dr. Keti, it's been an absolute pleasure. Thank you so much for joining me on the podcast.
My pleasure, Liz. It's so wonderful to speak with you.